Senator Menendez.
Well, thank you, Mr. Chairman. Mr. Secretary, good to see you. The Maternal, Infant, and Early Childhood Home Visiting Program, known as McVeigh, is a critical resource for young families that improves maternal and infant health, school readiness, family self-sufficiency, reduces abuse and neglect, and it connects families to community resources and supports. It's an evidence-based program that has shown the real impact early intervention and support can make for young families. Unfortunately, the last reauthorization did not include a funding increase, and we know that just over 3% of high-priority families were served through home visiting pre-pandemic. While I'm pleased to see support for expanding McVeigh in this budget, my hope and goal is that this program, which members on both sides of the aisle support, sees a meaningful funding increase in this year's reauthorization. So can I have your commitment to work with me and all of our McVeigh champions on this committee to make the critical investments in this program so that families can continue to get the support they need?
You have my commitment, Senator.
Thank you. Let me turn to the question of Title 42. DHS intelligence officials are predicting an influx of migrants arriving at the southern border in the coming months. This is a seasonal trend matter, but also about the much anticipated end to Title 42. Title 42 is being used to evade our asylum laws. We have a law on the book. It is our international, not only our domestic obligation. And it was abhorrent under President Trump, and it's abhorrent under President Biden. Some of my colleagues who somehow think that it should be extended are making a huge mistake, because all Title 42 does is it has migrants making multiple efforts to cross versus knowing that there is finality in an adjudicated asylum claim. So how is HHS preparing for the likely increase in unaccompanied children that are arriving at our southern border this summer?
Senator, thank you for the question. We are in the process of projecting what our needs will be. I want to thank you and the members of the Senate and the House for providing us with additional resources to deal with the unaccompanied children who have come into this country, who are going through the asylum process. We have stood up as many of the licensed facilities as we can. Those licensed facilities that care for these children are separate and distinct from the care facilities that offer services, for example, in foster care to our kids from America. But we have worked with that universe of licensed care providers to make sure we can offer these children during their temporary stay with us the best care we can afford to provide them. At the same time, we do prepare, in the event that we have to stand up additional facilities, those that can provide the emergency care necessary so that DHS, when it must transfer those kids over, will have a place where they can stay temporarily.
So let me ask you in that regard. Last spring, very concerning reports emerged regarding the conditions for unaccompanied children housed in HHS emergency intake sites. And at that time, the department officials expressed their intention to depopulate and close these short-term facilities as soon as possible. However, as of April 1st, there were still 2 emergency intake sites open, housing approximately 2,100 children. Is the department still committed to closing these emergency intake sites and placing unaccompanied children with long-term shelters in your licensed care provider network?
That is the goal, Senator, because it's required by a court decision as well. And so we make every effort, every spot, every slot, every bed that we can find that is under a licensed care facility, we use. And because we don't have sufficient numbers, in previous years, many of those licensed care facilities disappeared because the system was dismantled by the previous administration. We have worked hard to build it up to increase the number of licensed care facilities, but when there aren't enough, we still have the obligation to care for these children. That is when we do stand up those emergency facilities.
Okay. And then we have a commitment by the president to give refuge to 100,000 Ukrainians. Is the department making preparations for that as well?
We are, Senator, and thank you again for the resources to make that possible. just as we provided that refuge for the 68,000 or so Afghani refugees who've come through, we will be prepared to do the same for those who come from Ukraine.
I'll close just simply by saying I'm disappointed that our COVID package does not include any international assistance. We cannot meet the President's goal of helping to vaccinate 70% of the world by September if Congress doesn't include any amount for the Global Vax Initiative. And, you know, diseases and viruses know no borders. We can't hermetically seal ourselves off. It's in our own interest to do this, and I hope you and the administration will continue to advocate for it.
Senator Menendez, before we go to Senator Carper, let me just say I very much appreciate your points, and especially that last one. The fact of the matter is the main street in New Jersey in a community or the main street in Oregon in a community is affected by these health practices that go on around the world. The world keeps shrinking as a result of modern communications and modern transportation. And even if you don't